Hi everyone, welcome to our channel. My name is Zethu. I am a registered nurse. Today, I would like us to discuss the condition hydrocephalus in children. On our previous video, we discussed hydrocephalus in children, but we're concentrating more on types of hydrocephalus, signs and symptoms, and cause of hydrocephalus. Today, we will be talking about the diagnosis of hydrocephalus and the treatment. What is hydrocephalus? Hydrocephalus is the condition that occurs when there is accumulation or excessive accumulation of cerebrospinal fluid within the brain and the spinal cord, and it causes increased pressure. As a result, the brain tissue is damaged. How this condition is diagnosed in the hospital. Once the parent has discovered that the child is showing all the signs of hydrocephalus, the child needs to be taken to the hospital immediately. In the hospital, the child needs to be seen by the neurosurgeons or neurologist that will do all the tests to confirm the diagnosis. What are the tests that will be done? One, they will do physical examination. On physical examination, they will be looking for signs and symptoms of hydrocephalus, of which one is the prominent enlargement of the head. The fontanelle is bulging. The eyes are sunken. There is slow reflexes. And if the child can talk, and the child will be complaining of headache. There is quite a lot of signs and symptoms of hydrocephalus. And then another test that they will do ultrasound to get the image of the brain so that they know what is happening in the brain. Ultrasound can be done on those children that are still having fontanelle not yet closed. CT scan will be done and MRI will be done. All these tests will actually help the doctors to know what is really happening in the brain. They can see the fluid and they can also see the ventricles. The main goal of treatment is to prevent other complications that can be caused by the hydrocephalus on the child. And another main goal is to restore the normal flow of cerebrospinal fluid. And they can also divert the flow of cerebrospinal fluid to another part of the body where the cerebrospinal fluid will be absorbed. And the pressure in the brain needs to be reduced. Therefore, that's another goal of doing the treatment, so that the brain, we are reducing more damage that is caused by this extra fluid. The diagnosis. Once the diagnosis is confirmed, the surgeon will decide what procedure that can be done for that particular patient. Procedure depends on patient to patient. One is the endoscopic treatment. There is a treatment that they can do through the scope. One of the procedure, we call it third ventriculostomy. And another procedure, they can do choroid plexus cauterization. The common procedure that they actually do, and it has been done and it has been successful for so many years, is the insertion of shunt. A shunt can be inserted into the brain, and from the brain or from the ventricles, it is tunneled down. It's a long tube that is tunneled down into the peritoneal cavity, where the absorption of cerebrospinal fluid will be absorbed in the blood stream. The shunt is a special kit that consists of the ventricular catheter, it consists of the valve, and it consists of the peritoneal catheter. Once the doctor has made a decision that he's going to insert a shunt on that particular child, the child needs to be admitted into the hospital because the procedure will be done in theater. The child will be taken into theater after all the preparation that needs to be done when the patient is going to theater. And in theater, the procedure will be done under general anesthesia. Once the patient is asleep, the doctor will clean the head, will clean the neck as well as the abdomen. And if the head needs to be shaved, a small area will be shaved, and then it will be followed by cleaning, and the patient will be draped with sterile drape. Doctor will make an incision, small incision into the scalp, and he will make a bare hole. He actually make the hole into the scalp. And through this hole into the scalp, that is where it's going to insert a ventricular catheter. The ventricular catheter will be inserted, connected into the valve, and another incision will be made into the abdomen where the peritoneal catheter will be placed. The ventricular catheter and the peritoneal catheter will all be connected into the valve, and the CSF or cerebrospinal fluid will be flowing from the ventricular catheter right down into the peritoneal catheter, and all the fluid will be emptied into the peritoneal cavity where it will be absorbed in the blood stream. Once they are all satisfied that the operation is successful, it's successful if there is a continuous flow of this. It's a peritoneal catheter, it's the valve, and it's a ventricular catheter. Starting from the head, ventricular catheter is the valve, and the peritoneal catheter that emptied into the abdominal cavity. And then once they satisfied and they see that the catheter is working very well and the fluid is draining through this catheter, and then they will close the hole in the head, and they will also close the hole in the abdomen. The patient will be reversed from anesthesia, and the patient will be taken to recovery room. From recovery room, the patient will be taken into the ward. It is important for this patient to be kept in the ward for some days. While the patient is in the ward, it's a continual monitoring of the head circumferences. By this time, if the catheter is working very well, the head will actually go down because the cerebrospinal fluid is no longer accumulating in the head. This catheter is going right through with this catheter and is emptying down into the peritoneal cavity. They will also watch for the signs of any infection, is either from the incision on the head or the incision on the abdomen. They will also monitor if there is any leakage. If everything goes well, the child's condition is supposed to improve. Once the neurosurgeons are satisfied, the patient will be discharged. But it's so important to give the instruction to the mother if you notice any changes from the child, or the child is getting sick. The child needs to be returned into hospital immediately, because that can happen. Maybe it can be due to shunt failure. These children with hydrocephalus, they work with their doctors continuously, because it's not a once-off treatment. You'll find that sometimes if there's a problem, the child needs to be taken into the hospital and redo the procedure or do another alternative procedure. The mother needs to be educated. There's a lot of team members that are involved here with these children. If the child maybe has been having some problem in developmental, there are developmental therapists. There will be some occupational therapists. There will be a lot of support group that will be working with the doctors, and they will also be working with the mother. And shunt procedure has worked very well, and you will actually see the improvement of the child, and the child will start doing well. All the problems that the child has been having before will be improved, but it's also important for close monitoring, and the neurosurgeon will be always working with the parents of that child. It's not a once-off thing. It's very important for mothers or the parents to work hand in hand with all the team that is involved into this developmental of this child. While the hydrocephalus, you cannot actually prevent. Sometimes hydrocephalus can be congenital, and if the hydrocephalus is congenital, it is important for a pregnant mother to start antenatal clinic early, because the child can be diagnosed if he's presenting with hydrocephalus while he's still in the uterus. Therefore, by the time the child is born, immediately the treatment will be started. Therefore, it means that child will be immediately being examined by the neurosurgeons if they feel that the treatment needs to be started, and it is always better to start the treatment early. On acquired hydrocephalus, this condition usually develop on infant, toddler, or bigger children. Sometimes there is not much that you can do, because it can happen that the child can get hurt while he's playing. But what is important as parents is to make sure if the children are playing, they are under the supervision. And secondly, if they are on their bikes, they are using the protective equipment like helmets to protect, to protect their heads even if they do fall. Therefore, it is so important to make sure that the parents and all the team members that are involved into the health of this child work together. Our main aim here is to improve health and make sure that we minimize the complication that can be caused by hydrocephalus. For today, we will end here. If you do like these videos, please share, subscribe, and comment. Thank you for watching. Stay safe and stay